Welcome back. More than 300 million people live with 6,000 rare diseases, and that's according to Dr. Caleb Bupp, Division Chief of Genetics at Spectrum Health. Dr. Bupp joins us this morning to discuss some examples and more in a virtual event surrounding this topic. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
Absolutely. So what is Rare Disease Day, and when is it all taking place?
So Rare Disease Day is typically observed the last day of February, the rarest day of the year. And in previous years, we've had an in-person event, but this year, because of COVID, we've switched that to actually a week of virtual events. So that'll be starting on Tuesday, February 23rd and run through Saturday, February 27th.
And what types of things will be taking place throughout that week?
So we have a lot of different things planned for a lot of different audiences. So there's a little bit for everything. We're kicking off Tuesday night with a keynote speaker, Dr. Matt Might, who was heavily involved in rare disease himself as a researcher, but also as a father. So that'll be a great start. And then the following nights and Saturday morning, we have things for students and parents and families and people who work in healthcare. So there'll be chances to learn and dialogue and really network and build community.
Wonderful. All right, we talked about 300 million people that live with a rare disease, but what are some examples of these rare diseases?
So rare disease is defined as, less than 1 in 2,000 people having a condition. So it could be anything from something like Down syndrome, which many people may be familiar with, to a lot of kinds of cancers are rare diseases. And then there are lots of neuromuscular problems, issues with the hearts. There's really a huge variety, which is what makes this touch so many people.
And there's actually a rare disease named after you. How does this happen?
So I was part of a team here at Helen DeVos Children's Hospital that partnered with a research group at Michigan State University that we really started with a patient who walked into our lives. We were able to understand what her disease was and explain it. And last month, the name became official. It's called Bachmann-Bupp syndrome, and it is truly rare. We're aware of 9 people in the world that have this disease, and the first one that was ever known was right here in West Michigan.
And what is that exactly?
So that particular syndrome is a condition that has a developmental delay, so slow to walk and talk and things like that. But the thing that's been most unique to us is individuals who have our syndrome are born with hair, but then lose it very shortly after birth, which is very unusual. We're also extremely excited because this is a particular disease that appears to have treatment possibilities. And we've had the pleasure of undergoing a treatment trial for one single patient with this rare disease, and are really excited with the promising results we're seeing.
And I know we have such a strong medical base here in West Michigan and throughout Michigan. So how involved are you and others as far as dealing with these rare diseases and studying maybe new ones that come out?
Yeah, Rare Disease Day has really turned into a labor of love and a true collaboration. So the event is a partnership with Calvin University and Michigan State College of Human Medicine, and we're looking to bring on more partners in the future because we know that this is patients and families who get health care here at Spectrum Health. We know these are folks who need research done, which Michigan State and Spectrum certainly can participate in, but these are also folks that need learning and education, and that's where Calvin University and the efforts that they put forward really kind of round out the mix. So we've really crafted this work as an all-hands-on-deck approach because we know that rare disease really requires that.
And because of that, because of the approach to this, have there been any major breakthroughs?
Well, I think the thing that's most exciting for this year is that not only are we moving to a week of virtual events, but we've really spun this off to something we've called the Rare Disease Network. And that is a sort of an independent group here in West Michigan and hopefully beyond that will give a place for patients and families to connect really on a year-long basis. So it's not just one day of the year with Rare Disease Day that we gather together, but there's the opportunity to really build a community. And we think that shows a lot of promise for our area to really work together and to see this grow and to kind of get to those sort of breakthroughs and things that we want to see and that we need in rare disease.
And real quickly, how do people register for the event?
Sure. So the easiest way to do it is to go to rarediseasenetwork.net. That'll tell you more about the Rare Disease Network, but it also has the information for signing up for the event. It is free. There's no cost. We have something Tuesday, Wednesday, Thursday, Friday, and Saturday. You can come to some, you can come to all. It is all virtual, so hopefully a lot of opportunity for people to join and participate.
Dr. Bupp, we thank you for your time.
Thank you so much.
Thank you. All the details right there. Go to spectrumhealth.org to learn more.